Now, today we will discuss the tips of the anatomy paper. That how to attempt anatomy questions in the theory. Because anatomy is a very difficult subject in the first year. The student is perplexed that which diagram we should make in which question and how to attempt the various questions. Nowadays, in the paper examination of the anatomy, the pattern of the questions they are: number one is the long question. Now this long question is about 10 to 15 marks. If a question is labeled as 10 to 15 means, being a teacher, we assume and we expect that student will fill 10 to 15 pages. Means this one page including backside. So in this way 10 pages. Now problem arises that how to attempt and how to make so many pages of the answer. So in professional college, you will score high only when you write essay type questions, especially in the long questions and the short questions. The easy one is the long case or long question, that headings are already given. For example, explain the spleen under the headings of number 1 morphology, number 2 relations, number 3 apply. Now the examiner has already given you the topics under which you have to explain the spleen. Now there is no need to write down A to Z about the spleen. Now you are specified that you have to explain the spleen only and only under these 3 headings, nothing else. If you write, we won't read it. We will only read whether you have written under these headings, 3 headings or no. So this is the how to attempt the question. Now, how to fill 10 or 15 pages. Now you write down 2 words and the space between the 2 words should be more. And you write down by skipping one line. So skipping one line, then next. In this way, you can fill the page very easily. So these are the small tips. When you write down like this, skipping one line and writing the 2 words away from each other, it gives a clear picture of reading to the examiner, and examiner will be happy because the attempting question is good, that you have made a good. Another thing, anatomy is the subject of diagram. You should not leave any question without diagram. Diagram is the must. If you make a diagram which is well labeled, it means we do not read what you have written. Because we assume that a student who can write down or who can make a well-labeled color diagram, it means he or she knows the answer. So go to the practice while revising the anatomy syllabus by making the diagrams. And what is the anatomy answer? Only the diagram you have to explain. That is the answer. Now second type of the question will be asked is the short question or short notes. This question carries about 4 to 5 marks. 4 to 5 marks means you have to fill 4 to 5 pages. This should be your goal. It may be 3 or it may be 2.5, but goal should be 5 or 4. And what about these questions? Usually these questions, they are on the muscles, arteries, veins. and nulls. If you attempt any muscle question, then there should be 5 headings of the how to explain any muscle of the human body, small or large. Headings, they are fixed. Number 1 about the muscle is the origin. Number 2 heading will be insertion. Number 3 heading will be null supply. Number 4 will be the action. And the 5th last, we have to write down about the applied of the muscle. So muscle has to be explained under these 5 headings. And these 5 headings, you have to make the headings, then you have to explain 2-3 lines about origin, 2-3 lines about insertion, origin. Every heading should mark about 2 or 3 lines. So this will explain, or you will make an essay type question. And whenever you have to attempt a short note, first heading of the short note is the introduction. Any short question or short note, you have to describe, the first heading should be introduction. Under this heading introduction, you have to fill 2, 3, 4 lines. You have to give the vague idea, nothing specific. Because you have to keep in mind that I have to fill more pages. Then how to increase the number of pages is one of the trick. Number 1, introduction. Nothing specific. You like 3, 4, 5 marks. For example, there is a question that explains the tonsil. Then under introduction heading, what you will write down? That tonsil is a lymphoid gland lying in the oral cavity on either side of the tongue at the start of the GIT. It is the first line of the defense of the GIT. So you have written 3 or 4 lines. Nothing specific. It is general about the tonsil. Then you start writing systematically the morphology of the tonsil, borders and surfaces, then folds of the tonsil, then its anatomical position, then its blood supply, nerve supply, relations, applied everything. So you have to write down the headings, introduction, then morphology, then blood supply, means arterial supply and venous drainage, then its nerve supply, then its relations, and apply. So you have to make small headings and then write down few lines over every heading. This is how to expand your answer. You have to make a small essay about everything. If the question depicts the describe or the short notes, write short notes or describe this and that. So this is how to attempt this question. Now, another question of the third variety you will be asked is the drawing table. Now this drawing table question is very important in the anatomy because it usually carries 5 marks. So examiner will only give you the 5 marks when you will draw a very beautiful, clear, pencil colored and well labeled diagram. You have to not to write down any theory about this question. Only diagram, which should be very clear and very well labeled and very well colored also. In the short note, you can draw a diagram which is substandard, which may be not up to the mark. That is okay. In the short note, we will more focus on your writing material, more pages. But the question which only having the heading drawing table, we will give the utmost importance in the drawing this. So note these small things. The fourth type of the question will be asked is the enumerate. So enumerate is the question in which you have to only name. No diagram is required in this question. No theory is required in this question. Only you have to number 1, 2, 3, 4, 5, 6. For example, you have written dash this usually also carries 4 to 5 marks. Enumerate the branches of the external carotid artery. Then only you have to write down 1 to 8 branches, name only. Nothing specific, no diagram, no theory has to be written in this question. And the last question is the anatomical. Give anatomical clinical basis. So this question carries 2 marks. So in this clinical question or anatomical basis of anything, you have not to draw any diagram, you have not to make an essay. Usually the students mistake it and they assume that the anatomical basis question is a short note. No. You have to be very specific in attempting this question because it only carries that the only to the point answer. Usually the answer of this question is 1 to 2 lines. For example, which is the safety muscle of the larynx? You are not to draw the muscle of the larynx. You are not to write down about the action of nerve supply and anything about this muscle. You have to only to write down that the safety muscle of the larynx is the posterior cricoarytenoideus, and it takes origin from the arytenoid cartilage on the cricoid cartilage and inserted on the muscular process of the arytenoid cartilage, and action of this muscle is the abduction of the vocal cords, which will make the respiration okay, inspiration, expiration. It facilitates the respiration. So that's why it will save the life of the patient. Only that. If this muscle is paralyzed or damaged, it leads to the adduction or cadaveric position of the vocal cords and death may ensue. Simple. So 2 or 3 line answer is the answer of this question. Now comes the how to attempt the question of an artery or nerve of the vein. So whenever you have to write down about the artery, first you have to write down the introduction, that this artery is the branch of the so and so artery. Then you have to, second heading will be the branches. What are the branches of the artery? 1, 2, 3, 4 branches. Then you have to explain the course of each and every branch. That is very important. The third heading will be the course of first branch, second branch, third or fourth or so many branches. So you will take every branch, the first branch under the course. You have to write down a few lines, 1 or 2 lines about the how this artery arises and how it reaches the destination. That is the course. So that is how to attempt the question of the any artery, and last is the applied. Applied of that particular artery. For example, is a dorsal space artery, so you will write down that this is the one of the artery of the peripheral pulse count. Like this. Or if this artery is cut or down or damaged or compressed, what leads into a vascular necrosis of the structure supplied by it. So simple. Now if the question of the vein comes, now vein doesn't have got the branches, veins have got the tributaries. So tributaries you have to explain the tributaries. Then how to attempt the question of the nerve? Same at the basis of the artery. First you have to write down the introduction heading, then the branches of the nerve. 1, 2, 3, 4 branches, motor or sensory depending upon the nerve. Then the course, that how the main nerve arising from the spinal cord or from the brain, how it goes, arises and how it goes out. And then you have to take one by one every branch. And you have to write down 1 or 2 lines about every branch of the nerve. That how this branch arises from the nerve and how it reaches or supplies a muscle or the skin. And last is the applied, that if this nerve is cut, it naturally lead to the paralysis of the muscle supplied by them. or if it is a sensory nerve, it leads to the loss of sensation of some particular part of the skin. So this is how to attempt the all questions. And another is the question of the what is called joints. How to attempt the question of the joints if it comes. Then first heading is the same, that will be introduction. Second heading will be the bones. What are the bones? Two bones taking part in the joint, synovial joint formation. So you have to draw the diagram of both the bones. Articular part of the bones which are taking part, and you have to explain each and every feature of the bone, two bones taking part in the joint formation. Then the next heading will be the fibrous capsule. So attachment of the fibrous capsule to the joint, proximal and the distal bone is very, very important. Again, you have to make the diagram, and with the diagram you have to mark that where this fibrous capsule is attached, to a proximal bone or a distal bone. So anterior side as well as posterior side. So you have to make the two diagrams of every bone taking part in the joint formation. Then third heading will be the ligaments. Then what are the ligaments which are making them most strong? They may be intrinsic or extrinsic ligaments in some joints. And you have to take one by one every ligament, and you have to explain what is the attachment to the proximal bone, where is the attachment to the distal bone. Then it will come the relation of the joint. What is the anterior relation and posterior structure lying in surrounding the joint? Then the movement. So what are the movements of the joints? Flexion, extension, medial and lateral rotation. And last will be the applied importance. So this is how to attempt the difficult theory part of the anatomy examination. So this is how I have briefed it, that how to attempt these 5 questions, 5 types of the question in theory. I think this will be good for you. Hope for the best, all the best. Thank you.